Hello, everyone, and welcome to the Medical Trauma Support Podcast. And today we have Christen Mullane, and she is a clinical psychologist who specializes in medical stress and trauma. And Christen and I met because we are two of a very small handful of people that are working in this area. And so, Christen, welcome to the podcast. I'm super excited to have you here.
Thank you, Sarah. Thank you for having me.
Yes. And I just was hoping we could kick off with you telling us how you got into this area of medical stress and trauma.
Yeah, so a lot of my training and background is in health psychology. And so I've worked in medical systems my entire career, essentially. And interestingly, we don't necessarily talk all the time in health psychology around how the medical system itself and how health problems themselves can lead to a diagnosis such as post-traumatic stress disorder. We might be more aware of pre-existing trauma from other parts of life that may impact a person's care picture. But it took kind of living through some different healthcare systems and then coming out of it and into private practice to where I could see a little more clearly how the system itself can be hard on people, all the people in it. And so, at least in terms of my background, some of the different medical environments I've worked in have been emergency rooms, palliative care clinics, skilled nursing facilities, primary care. And so at all these different levels, right? But you never know what a person's carrying when they walk in the room as a patient. Right. And also what the providers are carrying when they walk in that room, or caregivers have, that they're holding.
Right.
So my sort of dream for healthcare is that we get these people in a room and they have a healing experience, like an actual healing conversation.
Yes.
Yeah.
That's beautiful. As a person who's both experienced medical trauma myself, but also as a parent, as a caregiver, I love that. And I will say that through my own experiences and research and searching, I have been able to find trauma-informed providers, both for me and for my children. And I have experienced what you're talking about. When you go in this state of sympathetic charge, and you're able to be met by a care provider who has clearly a very regulated nervous system. It's almost like they understand the importance of co-regulation and holding that calm, supportive space, and it is healing. Like each little experience, I just feel like it gets you further down that healing path when you have those positive experiences. And for one of my children who experienced medical trauma at an early age, after we have these positive experiences and we see, I see my child, their growth, after the appointment, I just really vocalize how proud I am of them and the work that they've done and point out how beautifully things have shifted. So I think that's amazing. And you and I have talked before about systems, like you were just saying, and that I think it's important for us to understand that there's this system, this healthcare system that has caused harm for many people in it, and not only for patients of the medical system, which you and I are both working with, but also for people working in the systems. I think sometimes if we're not working in the system and we don't know anyone who's working in the system, it's easy to miss what they're witnessing every day and what they're showing up to every day.
Yeah, I think the complexity of this is pretty staggering, truly, because if you think about how healthcare has evolved in our country, I mean, we're dealing not just with the people who are sitting in this exam room together, we're dealing with how things have been legislated.
Yes.
We're dealing with how, policy shapes this 20-minute medical visit. We're dealing with healthcare disparities in our country and the kind of access to health information that people have based on other parts of their lived experience, minority status, like any of these different parts of who we are as people. by the time we make it to that medical visit, we've been with our body for a while,
Yeah.
right? Like, and so we have a whole lived experience of what it's like to be in that body.
Yes.
That comes with us into that room.
Mm-hmm.
And I really do, to come back to your point about having a provider with a well-regulated central nervous system, that's fraught for providers in our country right now. And
Yes.
um, and it takes a lot of self-work. And unfortunately, this isn't work that providers always have the time and the resources to do.
Right.
Yeah.
Right. That's really where I think a lot of change could happen is because I do think we put it on the person, and that's not fair. The opportunity and the time for somebody who has just spent a shift in the emergency room, there should be time set aside for them during that shift to be able to process some of what they have just seen in whatever way that is right for them. It's different for everyone, but often people are going from a long, exhausting, intense, sometimes traumatic shift and having to go and pick their kids up from school if they've done an overnight shift or go home and make dinner. It's not realistic, and really it's unfair to put that responsibility on them to do that work outside of their work hours that are already long and exhausting. And so again, that goes back to the system and how do we care for people?
Right. Right. Like it's interesting because I don't know if you're familiar with the Commonwealth Fund, but they do some research on different parts of the physician experience.
Mm-hmm.
And they came out with this stressed out and burned out study in
Mm-hmm.
2022. And part of what that showed, this is just a fact about physicians in particular, but certainly other healthcare providers struggle with this as well. But they were looking at the physician experience
Mm-hmm.
and how many physicians actually seek mental health care.
Mm-hmm.
And it turns out physicians over the age of 55, only about 6% have
Mm-hmm.
gone to any kind of therapy.
Mm-hmm.
And under age 55, it was 16%.
Yeah.
So there are things that are changing, I think, in terms of maybe some internalized stigma about seeking healthcare for
Yeah.
themselves, mental health care. And also even on the side of like a physician provider who's trying to engage in some of this self work to deal
Mm-hmm.
with the things that provoke burnout or vicarious traumatization, right? Like
Mm-hmm.
there's real systemic barriers to seeking that care, like not just in
Right.
the hospital system, but in terms of whether they have to report this to medical boards and how
Right.
that gets handled. There's real fear, I think, amongst physicians around the consequences of actually tending to themselves,
Right.
actually taking time and guarding time to tend to themselves.
Yes.
So
Even
tragic.
it is tragic. And that's even outside of work hours. Yes. Yes. I have read some of that, and it is tragic. Because these people are stepping into these situations to help others, and they deserve to be cared for. And really, when the healthcare providers are cared for, the way that they show up with patients is different. And so it really is a system wide issue.
Right. Yeah, there's some other pieces of this where, there's such pressure in the medical system to get it 100% right every
Mm-hmm.
time.
Mm-hmm.
Like there's just such pressure to be a perfectionist in
Right.
that system. And so part of what we see too with providers is that if a mistake gets made, because the consequences of these mistakes, lives are on the line, right?
Right.
So there can be intense shame on the other side of that. And a moral injury, really. Like
Yes.
some of the messaging in healthcare, I mean, it's not stated exactly this way in the Hippocratic Oath, but there is that piece of first do no harm.
Yeah.
Like first do no harm. And really the actual principle these systems are acting out of is first save lives, but the mechanisms we have to do that are not always harmless.
Right.
And so mistakes happen. But yeah, so the mechanisms we have to do these things aren't harmless. And if people are stuck in a shame spiral, they're more at risk for burnout and additional errors on the other side of that.
And less likely to be able to be that calm nervous system that's able to co-regulate and, be there with compassion. And it really has a huge ripple effect, really. Yeah.
Yeah. So I think, there's different resources out there for physicians that I think are starting to be created. And I do think that what we can do as any kind of healthcare provider is pay attention to one another. Just pay attention and start to normalize seeking support. So some of the things that maybe listeners can kind of walk away from this conversation with are to know about the Lorna Breen Heroes Foundation. Dr. Lorna Breen, that was a physician who committed suicide in response to the pressures that she was under during the COVID-19 pandemic. There's also npsaday.org folks can go to, where they can learn more about physician suicide and have some tools and resources to help systems address mental health within hospital systems, within medical systems. So there's some good stuff out there where I think people are working to create change.
Yes.
And you're right. Like, as we do that work, as we do that self-work, and we operate from more of a place of awareness, then things ripple to the patient, right? To the caregiver who are coming into these environments.
Yeah. And I'll put links to those two things, the Lorna Breen Heroes Foundation, and I cannot remember the exact acronym.
Yeah, NPSA Day.
NPSA. I'll put those in the notes under this podcast episode for people to click on if they'd like to read more. And I know something else that you and I had talked about a little bit previously was about the element of grief in the area of medical stress and trauma. And we've talked about the providers and their experience and vicarious trauma. And I think there's grief there as well. But to shift more to work with people who have traditionally been patients in the medical system and the grief that comes up as they are working with you and we're in our peer support groups. I think that's such a big piece of the healing work is to first acknowledge the grief and within medical stress and trauma, there are so many layers, and there are layers that are very unique to medical stress and trauma. But I think grief is such a big piece of it. And I didn't know if you wanted to share a little bit about how you work with your clients around that grief piece.
I think what you're touching on in terms of its complexity is really important to acknowledge, because there's certainly, when we deal with medical events, grief related to loss of people that we love and we care about. There's also ambiguous grief. And I'm introducing that term kind of deliberately because part of what people struggle with is grief that isn't really about tangible things. It's about the hopes and dreams that they have for their future.
Yes.
And that changes after a healthcare issue comes up for a lot of folks, or grief for parts of the body. And there's no ritual for losing your hair as you go through cancer treatment. There's no ritual for these things. So part of what we can do as providers is to help a patient recognize that as grief that's legitimate.
Yes.
Right? So that it doesn't become disenfranchised grief.
Right.
We don't need to be saying things like, well, you're still here, right?
Oh my goodness. Yeah. Right. That feels like gaslighting.
Right. I think to really normalize that grief is part of this and that you are losing parts of your identity.
Right.
We lose beliefs about ourselves and about the healthcare system as well. A lot of us are really socialized to go into these environments with full trust.
Right.
And to really think about healthcare providers as rescuers, as heroes. And so when we can come out of these healthcare experiences with immense gratitude, and also a little bit of innocence can get lost along the way.
Absolutely.
And so,
Absolutely. And
yeah.
when you talked about a ritual, I just want to go back to that because I think that's so beautiful. And, that's something that I think those of us in the world of being with and supporting people in healing and processing medical stress and trauma is that we can offer up a space for them to come up with their own ritual that feels good and supportive. So I just think that's beautiful that you did talk about that ritual, because just because society doesn't have the ritual doesn't mean that we can't take space and create a ritual that feels really good for us.
Right. And it doesn't mean that the grief itself is not legitimate. Um,
Exactly.
and and I think, I mean, that's part of the unpacking in therapy too, is sort of recognizing these myths of mourning, which is directly addressed in therapies like cognitive processing therapy,
Mm,
um, where we kind of walk it through, like, what are the things you've heard about how you are supposed to grieve, quote unquote,
right.
and then starting to give people a little more room for their process to be their own. So
Hmm.
creating their own rituals, really helping them know that grief looks different for different
Yes.
people, and that just because even at different times in your life it can look different, right? So just
Hmm.
because you grieved one way before doesn't mean you're going to grieve the same way again, or just because you saw people grieve a certain way growing up doesn't mean that that's going to be how you engage with this process.
Right.
So really helping people understand that part, that they can drop into this experience how they drop into it, and that they
Yes.
have the right to ask for support all along the way. Um,
Yes. I love that. And I love the right to ask for support. Yeah. For people to understand that they deserve that. It is. We all deserve to be like loved and held and supported as we go through these hard experiences. So I think that's really beautiful. And I think that's something that we try to offer, right? I try to offer that as peer support groups and one-on-one support. And you do that as a therapist. And I think that you also have some groups. I believe it's already started. This one has, but it's for women who've experienced medical stress and trauma. And
right.
do you want to share a little bit about that and how that
Yeah.
group works?
Thank you for the chance to do that. Yeah, I'm really excited about this. So, the program that I developed is an 8-week program
Hmm.
where part of what I help women at this point is focused on women. My hope
Hmm.
is that future iterations will be for more diverse populations, for
Hmm.
caregivers. But at least at this point, women have the opportunity to learn advocacy skills and
Hmm.
safety skills for going into medical environments. Um, there's a lot of unpacking we might need to do sometimes around how we're again socialized to be the good patient, quote unquote,
Right.
and what that really means.
Hmm.
So some of what I help people do is to create like a safety and coping plan for going into medical environments after
Hmm.
something traumatic has occurred, so people
Yes.
can reclaim that sense of safety. We do a lot of mindfulness skill building.
Hmm.
And, coming back to that idea of ritual and grief, we don't have rituals for grieving beliefs,
Hmm.
but, and also mindfulness work provides a way of letting go.
Yes.
That can be a funeral for belief in some ways, like letting things flow, letting things, like our previous beliefs that don't serve us anymore, right?
Hmm.
Like starting to notice them first and then engage with some inquiry around that and let it go if it's not really working for us. So we learn, yeah, I help people learn mindfulness skills in there too. And while I'm kind of talking about that part, I think the key piece of what I'm offering is to do that in a trauma informed way.
Yes,
Because
which is
oftentimes, yeah,
crucial. And
yeah,
I want to just stop you there because
okay,
I think I want to hear more, but I just mean I want to stop you here just to really point that out, that showing up with somebody who is trauma
mhm,
informed is so important, because you want to be able to step into a place where you can do healing with somebody who understands what it means to step into a place with trauma and how that has changes the nervous system, and somebody who understands things that can often be very triggering to somebody who's experienced trauma, which quite honestly is most of us, right? It's not unusual to have experienced trauma. So I just wanted to stop you to point that out, and I would love to hear more. I didn't want to stop what you were saying about it.
Well, it's like a huge can of wax to unpack, right? But I
Yeah.
mean, there's a really great book by Trelevin, The Trauma Sensitive Mindfulness. So some of my training and background, I am a certified mindfulness teacher
Oh,
too.
wow. Yeah.
And a lot of my training is about being in the room and recognizing that you're right. Most of us are holding a history where we've been through something hard. Like by the time we reach adulthood, it's sort of rare to find a person who's had ease
Exactly.
the whole way through.
Exactly.
And so when it comes to medical events in particular, if you think about it, they're going to impact our central nervous system, our ability to focus and pay attention, whether it's because of medicine we've been prescribed or because of the injuries we've been through.
Mm-hmm.
All of those things are going to impact how we can engage in a meditation practice or in a mindfulness practice.
Yes.
The other piece that is just true is that a lot of our mindfulness practices and exercises are very embodied.
Yes.
And so that's not safe feeling for every person who's been through a traumatic medical event. So, for me, I might find a focal point with my breath and feel totally safe doing that.
Mm-hmm.
For somebody with COPD, that might not feel like the place to focus.
Right.
It doesn't mean that has to be forever. It just might mean we have to start low and go slow and really gradually work into that kind of practice or focal point.
Mm-hmm.
But anyway, so part of what the group helps to do is to help start to understand what trauma, how it impacts you,
Right.
so that you can recognize your triggers and then find a way into a mindfulness practice that actually offers you some ability to experience ease and safety with the practice.
Right.
Yeah.
And one thing I have also found in that embodiment area is to find a place, and it sounds like your group is an opportunity to do this, to allow yourself to dip a little toe in, right? To maybe some sympathetic charge or some of those feelings, but to know that you also have practices and a facilitator or therapist that can help bring you back to a little sense of safety. And I think the other thing that we should talk about is that many people, both who have experienced medical stress and trauma and that haven't, many people also have complex trauma, right? Trauma from childhood. And so for many people, being in the body has never been a safe place to be, even before the medical trauma that happened.
Right.
And so understanding that going slowly and gently is so crucial. And that brings me back to being trauma informed. Like what you talked about earlier is someone who is truly trauma informed understands that when you're working with trauma, you are not having somebody jump into the pool. You are understanding the importance of people dipping a toe in. And then and then you come back and then you may want to put two toes in, so that this trauma work is really slow and gentle work if you are doing it from a trauma informed place.
I agree. I think, even starting to conceptualize mindfulness as an exposure to
Yes.
our interior.
Yes.
And you don't want to flood somebody right away with the thoughts that might be painful, the emotions that might be painful. And these are things that can arise in a meditation practice.
Right.
It's not, I think the other piece that's coming back to that trauma informed approach, we touched earlier on shame when you and I were just talking. Um, and when trauma is present for people, if there's a sense that there's a right way to do mindfulness and a wrong way, and because I'm not Zen, or I'm not sitting here calmly, or I'm not able to do this for a certain amount of time, I'm doing it wrong, that can really land in a very shame sensitive space
Absolutely.
that's already inflamed because of trauma.
Yes.
You know, so there's a lot in terms of how mindfulness and meditation have been sort of packaged in our culture. You know, like some
Yes.
kind of myths around that to unpack too. That it will take away your stress.
Right.
It's a cure, and that you are going to be totally regulated inside as you're practicing it. Like there's some pieces like that that I think certainly we talk about in my group as being like, no, that's not always the case. Like we
Right.
might experience calm and other things can come up too. And part of what we learn is that it's not necessarily taking stress away. Stress is normal. It's part of the human experience of living on this planet.
Right.
But what we learn to do is to become a big enough container, right? That we can
Yes.
hold it without it spilling over onto other people or us being so reactive that, we're kind of like a bull in a china shop in the world.
Right.
So we just learn to hold it, right?
Yeah, you expanding the capacity is the way that I like to view it. Like you said, container, I love that too. But what we're doing in healing is just gently expanding the capacity, and a lot of that is through the nervous system work.
Yeah.
So I love everything that we're talking about so much. I wish we could just talk for hours, but before we wrap up, I just wanted to see if there's anything else you wanted to share. I know you have a group that's already currently going, but if you have anything else coming up that you would like people to know about. The other thing I wanted to say is I know that you are able to work in multiple states. You do some virtual work. So will you also let everybody know what states you offer therapy in?
It's a long list. So I think it's yeah, so part of what psychologists are able to do is to work under PsyPact
Okay.
to stretch your license into other places. Can
Is
you
that
hear
your
that?
puppy? Oh,
He found his lamb chop toy.
that is very
Anyway,
cute.
so he's here, but probably the easiest way for people to figure out if their state is supported is to go to my website. And so
Okay.
that's, yeah,
Will you
ginkoleafhealth.com.
GinkoLeafHealth.com. And I will also include that in the notes so people can go to your website and see if you practice in their state. And will you be starting a new group session sometime this fall?
Yeah, so there's a couple of things I want to make sure folks know, I guess. So October timeframe would be the next cohort of the RISE group. So that's reclaiming interdependence, safety, and empowerment.
Mm-hmm.
So if people are interested in that, they can certainly reach out to me ahead of that.
Mm-hmm.
So that's here in October 2024.
Cool.
And I think other things that I'm offering, so I was able to, this is a whole other topic, probably for like a whole other episode, but
Mm-hmm.
one of the things that a lot of folks are struggling with that I'm, holding here is medical debt, or
Oh
if you're
my
a
goodness.
provider, academic debt. So
Yes.
one of the things that my practice is doing, we've partnered with a pro bono certified financial planner. So that person is offering office hours to folks who work with us
Wow.
to help make a plan to get out of debt. So there's some cool things that I think are coming down the pike. Certainly within the next couple of months and years, I'm going to be building more things um, focused on like mindfulness skill building and support.
That's amazing.
We are.
And I guess I'm sure they can sign up for newsletters on your website so that they can stay up to date with all your offerings. Talking about the financial or the medical debt, I just learned of something that I will be sharing on my website. But there is a group called Undo, UNDUE, medicaldebt.org, that they are helping clear people's medical debt.
Oh, that's awesome.
I just learned about it this morning and I got full body chills. And so, because that's a huge layer to medical trauma for so many people is the financial impacts of it, which again, we probably should do another episode on that because it's a really big piece of this. But I'm going to wrap up and just say, I loved talking to you today. I just wish we could talk all the time because I just think so much of the work you're doing it's so beautiful, and I really resonate with that mindfulness embodiment work. So it's been wonderful. Thank you so much.
It's a privilege. I love it. Like being in the same brain space with you is so fun.
Yes.
Thank you for having me
Yeah.
on. I appreciate it.
Thank you so much.